Thank you very much for joining me. I want to say a few words today about our broken healthcare system and the need for us to join the rest of the industrialized world and guarantee healthcare for all as a human right. The quality of healthcare that a nation provides is not only a major factor in determining whether people live long, happy, and productive lives, but it gets to the heart of what a country stands for and what its values are. In a sense, nothing is more important than that. In my view, there is a fundamental and simple question that all of us have got to answer. Should healthcare in the United States be a right for all people, or should it be a privilege based on our wealth and our ability to pay? Let's be clear. The healthcare system in the United States is broken, it is dysfunctional, and it is cruel. It is a system which spends nearly twice as much per capita as any other major country, while 85 million Americans are uninsured or underinsured. Where 1 out of 4 Americans cannot afford the cost of the prescription drugs their doctors prescribe, and where over 60,000 people die each year because they don't get to a doctor on time. It is a system in which our life expectancy is lower than almost all other major countries and is actually declining. A system in which working class and low-income Americans die at least 10 years younger than wealthier Americans. It is a system in which some 500,000 people go bankrupt because of medically related debt. It is a system in which large parts of our country are medically underserved, where rural hospitals are being shut down, and where people, even with decent insurance, have to travel hours in order to find a doctor. It is a system in which, in the midst of a major mental health crisis, when over 100,000 people in our country died last year from drug overdoses, and where suicide, alcoholism, depression, and anxiety are rising, Americans are unable to find the affordable mental health care and substance abuse treatment that they need. It is a system where, despite our huge expenditures, we don't have enough doctors, nurses, dentists, mental health professionals, pharmacists, and other healthcare providers, and where we spend less than half as other countries on primary care. It is a system in which people spend endless hours filling out forms, form after form after form, and arguing with insurance agents. It is a system in which the quality of care you receive is largely dependent on the generosity of your employer or whether you have a decent union. It is a system in which millions of people stay on their jobs not because they like them, but because they need the insurance that the job provides. Further, our current healthcare system is not, as everybody knows, comprehensive. Yes, dental care is healthcare. Yet tens of millions of our people, including many seniors, cannot afford to see a dentist. Yes, the treatment of mental illness is healthcare. Yet our long-standing mental health crisis is now worse than ever. Yes, providing services to millions of elderly and disabled Americans in their homes is healthcare. Let's also be clear in understanding that while our healthcare system is failing ordinary Americans, it is working exceptionally well for the people who own the system. While more than 60,000 people die from preventable deaths every year in the U.S., the 7 largest health insurance companies in America made over $70 billion in profits last year, led by United Health Group, which made over $32 billion. And, not surprisingly, the CEOs in the insurance company and the pharmaceutical industry receive huge, and I mean huge, compensation packages. In my view, the function of a rational and humane healthcare system is to provide quality care for all as a human right. It is not to make tens of billions of dollars every year for the insurance companies and the drug companies. In 1965, President Lyndon B. Johnson signed the Medicare and Medicaid Act into law, declaring that the time had finally come to end, quote, the injustice which denies the miracle of healing to the old and to the poor, end quote. Today, almost 6 decades later, Medicare is the most popular healthcare program in America, providing comprehensive health care for all those 65 and older. It is also the best model, in my view, for healthcare reform in the United States. In the face of a dysfunction and failing healthcare system, the time is long overdue for us to improve and expand Medicare to cover all Americans. And that is why I have introduced Medicare for All legislation in the Senate, which would provide comprehensive health care coverage without out-of-pocket expense for every man, woman, and child in America, regardless of age, regardless of family income, or where they live. Medicare for All is a system based on addressing the health care needs of the American people, not the profit needs of insurance companies and the pharmaceutical industry. Under Medicare for All, there will no longer be insurance premiums, deductibles, or copayments. No more worrying about whether you can afford to see a doctor. No more arguing with insurance agents about the nature of your coverage. No more hounding by bill collectors for unpaid medical bills. No more worries about going bankrupt if you end up in a hospital. This legislation not only expands Medicare to cover all Americans, it also significantly improves upon the services for the elderly and the disabled. Would a Medicare for All healthcare program be expensive? Yes, it would. But while providing comprehensive healthcare for all, it would be significantly less expensive than our current dysfunctional system because it would eliminate an enormous amount of the bureaucracy, profiteering, administrative costs, and misplaced priorities inherent in our current for-profit system. In fact, the Congressional Budget Office has estimated that Medicare for All would save Americans $650 billion a year. Charting the right course, the humane and healthy course for this country in terms of healthcare is not going to be easy. We are taking on the most powerful economic and political forces in the entire world. But I have no doubt that the day will come, sooner than later, when we will succeed in making healthcare what it must be, a fully recognized and fully supported human right. Thank you all very much.